Hi, my name's Mark Stallard and welcome to Little Green Man. Here in Manitoba we've been waiting for news of cuts to public services, something the Progressive Conservatives have told us are coming. We know they are, we just don't know what specifically those cuts are going to be. They're going to be about over $124 million in cuts right across healthcare. That's what this video is about. Some leaks or some information has come out, not really leaks, based on what those cuts are going to be. And so it's important. I mean, the whole point of the cuts is because the previous government, the NDP government, left a rather sizable deficit. So the Progressive Conservatives, like all Conservatives, really get kind of unhappy and uneasy with any kind of deficits in government. And so they have to reduce that as quickly as possible. And so one of the ways they're doing that is making some cuts in healthcare. One of those was a big one I mentioned in my last video. 3 emergency rooms were shut down out of 6. And I think that's not going to be the first, and I know it's not the first. But some information has come to light via the Free Press, Winnipeg Free Press website. An article by Jane Gerster was published online August 10th of this year, so just a few weeks ago. It's entitled, and this is kind of going to give away pretty much the title of the article gives away the entire content, and you know exactly what's going to happen. It says, health cuts may include incontinence pads, blankets, washcloths. Snappy title, but really, I mean, that kind of tells you as much as you need to know. Read through it, there's details on all the little nickel and diming that's happening in healthcare. There's a couple of points that I want to make. You can read the article. This information has been in the public domain for, well, pretty much since then. Many people talking about these cuts and how bad or how ridiculous they are. The first thing that we need to say is that these are not law yet. These are just things that are currently being talked about. And so now is actually a good time for us to be talking about it, to make sure that if cuts need to be made, that they're made sensibly and they don't affect the wrong people. The first thing I think that, or the biggest thing rather, that comes out of this article from me is that all of this has been done in secret. The information we owe the NDP a little bit of credit here, actually a lot of credit. Because it was the NDP that actually went out of their way to put in for a freedom of information request from the government to get this information out. And so some information was forthcoming, and that's how we got this. It's really also very safe to say that this is absolutely done in secret. It's one of the, I'm just going to find a quote here. It says they've mostly kept details about cuts secret, leaving the public in the dark. And there's another quote in here: "Nobody knows anything." Now that's all fine. I mean, there are some things in government that you kind of want to get a clue on how you want to present it. Ask difficult questions and then come out and say, "Here's a solution," and then put it up for public scrutiny. The thing is, with the last big cut, with the emergency rooms, it became a big and total surprise to everyone. We didn't know it was coming at all. And certainly for those of us that weren't following provincial politics at the time, absolutely stunned by it. And so it's important that we examine these so we don't get caught out again. We don't get caught with our pants down, apart from it being a little bit chilly. So some of the things that they're going to be most affected by this is this. It does seem to be very petty, nickel and diming. That the greatest opportunities for savings were within medical and surgical supplies, says the article, in acute and private care facilities. There may be opportunities in certain areas to look at specialised products and appropriate use, such as incontinence products. The article goes on to talk about that the seniors that have incontinence issues were using pull-ups. And as a parent, I know on the young ones that the pull-ups are a big boost to their confidence when we're toilet training on the young ones. And then when they get them out of the diapers, great. And you can only imagine, now doing this in reverse, that you've lived a life, you've worked hard, and that, okay, you're going to have incontinence issues, some people are, but at least we can treat our seniors with dignity enough to at least give them discreet pull-ups underwear that they can wear. Now, the only other options, the only ones there was no details in this article about what specifically the products would be replaced with. But I went online and I kind of looked out adult incontinence products, and the only thing I could see that were not pull-ups were like big diapers, like big pads. And they're really just like child diapers without the sticky bits on the side. And the article goes on to say, actually I just read that appropriate use. So I'm assuming that means that they're used in the correct way. But certainly that kind of products you would need, you can't just slip them on yourself. Like, you've got to position them right, and I can't believe for a second that they're as comfortable as pull-ups. But it doesn't really come down to are they as effective or are they not. It's the psychological side of that I think is really what's essential here. They're people that have worked hard, are coming to the end of their life. The very, very least we can do is give them what little bit of dignity we can give them, and we should give them every bit of dignity we can afford to give them. Secondly, what else is being cut? There is another little element here too, is that mothers-to-be, it suggests new mums and mums-to-be could be asked to take their own postpartum pads and disposable mesh underwear to hospital. Okay, now this is getting a bit silly now. It's one thing making cuts, but it's another thing to tell people, oh no, you've got to bring your own stuff. Why? Because the progressive conservatives, and for some reason, taxes are an anathema. That's which is to be feared, that's which is to be hated. It's horrible, let's not talk about it. Let's get rid of taxes. But this is actually worse than a tax, because now you have to anticipate what you're going to need when you go to hospital. Right? I mean, when I go to hospital, I don't go, oh, I cut my arm, maybe I should get some gauze, or some antiseptic. No, that should be something the hospital provides. That's what our taxes pay for. So I'm paying my taxes, these mums-to-be are paying their taxes. Surely, they're paying for them already. Why do they have to pay for them after, when they need them only? Let's just pay a little bit of tax, put it into, it's an insurance, it really is. It's medical insurance that the government takes care of. We give them a little bit of money and they're covered. They don't have to worry about those silly little things. Instead, you're going to end up with a big, massive bill that maybe you can't afford. Particularly when mums-to-be are looking at their salaries or the wages being drastically reduced when they go on to maternity leave. So there are a couple of things there. First of all, this is going to affect the most vulnerable people in our society. The dignity, the extra expense, just when you can't afford it. And then it's all done in secret, so we don't even get an input on it. So there are two things that I thought I took out of this. People have been talking about this online and amongst themselves. I don't think I need to go through this anymore. But those are two things. Let's treat our old people with dignity. And let's talk about these things in public so that we can do something that is good for everybody and not just so that numbers look good on a spreadsheet. Little Green Man.